Good morning. We are 8 months into this pandemic and the numbers are alarming. Our hospitals are reaching capacity and more families are feeling the impact of this virus. Prolonged anxiety hangs over our heads as a virus with no cure spreads quickly through our community. We have worked hard to keep this virus under control in St. Louis County, and we will stay the course. But we need your help. Our early stay-at-home order, one of the first in the country, went a long way into protecting the residents of St. Louis County and keeping our hospitals from being overwhelmed. Our current restrictions that are in place are aimed at protecting us all while allowing our businesses to operate with limited capacity. We have a mask mandate that allows gatherings of small crowds, allows our businesses to remain open, and allows our children to have an opportunity at an education in a classroom. Sadly, public health orders such as a mask mandate have caught up in a political battle aimed at me and aimed at other elected officials who make decisions based on science. But the actions to end public health orders in St. Louis County have threatened the safety of everyone. Public health orders across the country have been attacked by those who want to use them as a political position. As a result, we see COVID-19 numbers escalating across the United States. When some political leaders refer to this pandemic as a hoax or a mask mandate as an infringement on their rights, they are encouraging irresponsible behavior that has us where we are today. Frustrated that all we have done in St. Louis County may have been for naught. The leaders of our healthcare facilities have been sounding an alarm for weeks. We are on a fast track to a crisis, and the only way to keep it from getting worse is for everyone to do what they can to keep the virus from spreading in our community. That means wear a mask, work from home when possible, wash your hands frequently, avoid gatherings, and social distance everywhere you go. That means work, that means in a classroom, that means in an office, in the grocery store. We're seeing numbers jump because small groups are gathering and people are hanging out. More people are becoming complacent about the public health orders. I get it. It's been a very long 8 months, but we have to hang in this together. With holidays around the corner, we need to rethink and even reconsider our traditional gatherings. Flu season is almost upon us, and we know that some of our residents will be very sick from the flu. That's why it's so important to get a flu shot and do everything we can to keep the incidence of flu down in our community and keep our hospitals from being impacted by people who are sick with the flu. This has been an election season like no other. It's my hope when the ballots are cast, we can all come together. Division weakens us as a country. Without a unified front, as COVID-19 rages on, it's going to take more and more of our patients, more and more people will be sickened. We have the immense power to make a difference in following the guidelines that can keep us safe, to allow our businesses to continue to operate safely, and to allow our kids to have a chance at an in-classroom learning. Last week, I spoke with several reporters. They've been seeing the numbers, following the data closely, and they had a lot of questions. Should we expect more restrictions? Are we going to see more stay-at-home orders soon? Those are the common questions. But I want to avoid, at this point, taking any actions that will jeopardize our businesses or disrupt our school curriculums. The restrictions that we have in place can work if everyone abides by them. If you don't feel safe going out and you can avoid doing so, then you should stay home. If you're feeling sick, then you should stay home. Just because something is allowed doesn't mean that it is without risk. Going anywhere indoors where there are crowds is considered risk. The 50% capacity restriction prevents fewer people from being in one space at one time. But the higher the capacity, the more people in one place, the higher the risk of transmission. And places of worship can still have several hundred people gather within the capacity limits of their buildings. And during these times, leaning on our faith is more important than ever. But please wear a mask and follow our guidelines for being socially distant. The virus does not stop at the doors of our churches or our synagogues or our mosques. We are seeing small clusters of cases from every gathering place. That includes our places of worship, gyms, bars, frontline workers, and even stadiums. None of us can afford to allow our hospitals to be overrun. We're averaging over 327 cases per day in St. Louis County. If the number of new cases continues to rise, our hospitals could be impacted. They could have difficulty taking care of non-COVID-19 related patients, including folks with strokes, heart attacks, even people involved in motor vehicle accidents. So I ask you, please set aside your frustrations, your inconveniences, your yearnings for normalcy. Working with our neighbors, our family members, our frontline workers, and our hospital healthcare professionals. We don't get past this virus until we all agree that the best path forward is compliance with our public health orders, all of them put into place to keep us safe. Thank you, and I'd be glad to answer questions.
Dr. Page, is there a point, and you alluded to it there about the rising cases, the numbers going in the wrong direction, and now we have this tragic case out in Washington of this middle school student who died from COVID. Is there a point where you get to, we need more stay-at-home orders, we need another lockdown? Is there a breaking point there? And with the case in Washington, are there new questions about going to school safely?
Well, I think we've always known that kids can get sick from COVID-19 like adults can. And we know that they can be in the hospital, and we certainly know that some of them can lose their lives. We don't see it frequently, but it's certainly possible. We also know that our schools have instituted measures to keep their kids safe, and following those measures, following our social distancing guidelines, mask wearing, we think offers a great deal of protection. But as these case counts get higher in our community, we're going to be revisiting all of our public health orders. We'll revisit our gathering guidelines, our restrictions, and we'll even be watching the data surrounding schools. We're not there yet. We are hopeful that everyone in our community will double down on our public health guidelines, that the conversations about eliminating public health guidelines, about not complying with our public health orders will end, and we really want to see wider compliance with our masking orders and our social distancing, and we hope that everyone in our community will rethink or reconsider their plans for traditional holiday gatherings with people who they don't live with.
Is there a red line that you reach when you get to a certain number where you have to consider another stay-at-home order or another lockdown?
Well, we're watching, our public health department publishes a dashboard with several indicators, and they include hospital capacity, ICU admissions, ventilator usage, the number of cases in our community, the positivity rate, the rate of rise in our community, which is becoming more alarming. All of these we watch very closely. We're also interested in certainly in the availability of our medications that treat COVID-19 patients and our PPE capacity. We're not there to the point yet where we're ready to offer more restrictions, but if we continue on this trajectory over the next couple of weeks, we're going to be having some very difficult conversations. Any other questions? Doug? Yes?
What's the message then to the community, Dr. Page, you alluded to it there. Are we kind of at the point now where people need to redouble their efforts to wear masks, to social distance, to try and prevent any of these additional things from happening?
We're certainly at a turning point in our community, and we're getting at that turning point this week. We need to see greater compliance with masking, which in St. Louis County is pretty good, but it's not there. We would like to see greater compliance with masking in the rest of the state. We're not there, but certainly here in St. Louis County, there are some things that we can do to slow the spread of this virus. We really need to look at our gatherings. Everybody needs to really think about gatherings in their home, especially with holidays around the corner, with Thanksgiving a few weeks away. We really need to think about whether or not having a family gathering with people outside of your home is a good idea. Okay, thank you.